Hi, I'm Sue Marie, the inventor of the 3-in-1 dialysis simulator, and today I want to quickly show you how easy it is to cannulate and access the simulator. Obviously, it's the 3-in-1, so here we do have a catheter. If nurses are going to be training and connected to the dialysis machine, we would use the catheter. We also have the peritoneal dialysis catheter for PD training. But what we're going to focus on today is the AV fistula. So the AV graft. It's artificial AV graft. So what we're going to do is we're going to connect the graft to the catheter. The catheter acts as our heart, and it's going to circulate the blood throughout once we connect. So we're going to connect blue to blue. Open the clamps. Red to red. Red for arteria, and blue is for venous. And so let me stop here for a minute. In a clinical setting, you would be wearing gloves. You would also sanitize your hands before approaching the patient and donning your gloves. You would have a mask as well as the patient. So just for this quick demonstration, I'm not doing any of the above, but just keep that in mind. You would follow those procedures. Okay, so you always obviously want to assess your fistula before you actually cannulate to make sure there's blood flow going through there. So what we have here is 17 gauge needles. I wouldn't advise using any larger needles just to preserve the integrity of the graft. So the red is for arteria and the blue is for venous. So we're going to start with the arteria, and you can see the bevel is up. And depending upon the size, you don't really need to go 45-degree angles on a graft because it's not as deep as a fistula typically is. But we're just going to go in, and you can feel a little pop when you're in, and then level your bevel up and continue to insert. Same thing with the venous side. We're going to go in, level up. Okay. And at this point in time, you would secure this with some tape, but since this tubing is nice and thick and tight, it's secure here. Okay, so the next thing I'm going to do is I'm going to take a syringe and make sure all the clamps are open, and I'm just going to aspirate. Open this one. Just going to aspirate blood out. Okay. Make sure I got a good flow. And as you can see, there's a flow. Okay. Go ahead and recap that. It's a good idea to have 2 syringes, that way you don't have to recap. And then repeat the same exercise on this side. Open your clamp, aspirate. And then you can flush back and forth just to check for patency. If you have any air bubbles, you really want to go ahead and expel those out. Okay, so now that we see that it's patent, our machine is ready. We have a pump here, and obviously on the dialysis machine there is a pump. So for demonstration purposes, I'm going to make sure this is clamped. If you open any clamps, you'll have water running everywhere. Okay, and so I'm going to connect my arteria to the arterial side. We'll secure that. And then the venous. To the venous needle side. Secure, open. And then now at this point you want to make sure that all of your clamps are open so that we can do what? Circulate. Okay, so I'm just going to start the machine. As you can see, the blood is starting to circulate through. And notice these bubbles here, so that's what I was saying. So before you actually connect, you want to make sure that your heart is completely filled, the volume is completely full. And then when you cannulate, or even before if you're using a catheter, you just want to aspirate and make sure you have a smooth flow of blood outside of the catheter. And there you have it. I'm going to go ahead and pull these needles out so you can at least see that we don't have a lot of leakage everywhere, and so you have multiple use from this simulated graft. So I'm just going to go ahead and pull that out and pull it out here. And so then you can take a look. Okay, there you go. Thank you for listening.